Hi, Igor. How are you?
Long time no see. My name is Igor Elyash. I'm a general surgeon working for the Valley Medical Group here at Valley Health System.
And I'm Seema Dhorajia. I'm one of the general and bariatric surgeons, also at Valley Medical Group.
And we have some questions from the community. So question number one, what is general surgery and what type of procedures does it include?
General surgery is very broad-based, so it includes a lot of different procedures, including lumps and bumps, which we see a lot of, and pretty much anything in the abdomen or the belly. So gallbladder, hernias, appendix, intestinal surgery, stomach, spleen, liver. It's pretty much all-encompassing.
And oftentimes as general surgeons, we are oftentimes the first referral for a lot of disease processes. And if there is something that is a little bit more complicated, something that requires a certain specialized surgeon, we will usually make all the referrals and work with our colleagues in order to make sure that you're getting the right care.
When should someone consider seeing a general surgeon?
General surgery is such a broad field that there are a number of disease processes that we do see, but certainly if there are certain lumps and bumps on your skin that you've noticed that are new, that are growing or changing or causing any sort of symptoms, oftentimes we will get these referrals and we'll have patients come to our office regarding that. In the abdomen, sometimes abdominal pain, nausea, vomiting, issues with going to the bathroom, they could be a sign of a surgical issue. Certainly a hernia, a bump in the groin, or a bump in the abdomen, sometimes after previous surgery. All those things we'll see as well, and we'll work with our primary care colleagues in order to really make the right diagnosis and to really see if someone really needs surgery or not.
And a lot of times these patients, they see their primary care physician, they see their gastroenterologist, and more often than not, once they've seen one of them, usually they'll send it to us if they think there's something more surgical to it.
What should patients expect before, during, and after surgery?
If we're doing lumps and bumps, most people recover in a week or two after removal and they're out and about even same day. As far as abdominal surgery, both of us primarily try to do most of our surgeries with little incisions, but it does still take about 4 to 6 weeks for a full recovery. But most of our patients, since it's done through little incisions, are walking around right away, even same day, secondary to, it's decreased pain.
Yeah, and for the most part, even after we're out of the period of recovery after surgery, sometimes we'll have patients come back sometime down the line, and whether or not they have some new symptoms or they're concerned about their previous surgeries. And, we will see patients and we'll be available to help them and assist them and hopefully guide them in the right direction.
How has surgical technology advanced to improve patient outcomes?
So surgical technology is very important to what we do. We started as a field doing surgeries through big, large incisions, causing patients sometimes quite a bit of pain, having a longer recovery, higher risk for infections and other complications. And really over the last 30, 40 years, we've been transitioning more to a minimally invasive approach to allow the use of keyhole incisions so patients can recover faster, patients can get through their surgery much easier, and more importantly, spend time with their family, get back to work, and get back to their normal lives. And now we are moving more into robotic surgery, which uses those same small keyhole incisions, but now uses the robot to allow for precise movements, a better visualization, and allow for a much more efficient surgery to be performed.
Really, we're getting a more magnified view of what's going on in the abdomen.
Absolutely. What are the benefits of minimally invasive and robotic-assisted surgery?
Patients can be out and about and get up and walking a lot sooner than if they had a bigger incision, and it's significantly less risk of complications.
Absolutely, and you can see a significant difference between patients who've had a previous operation done with an open incision compared with the smaller keyhole incisions. They generally have a much faster recovery, generally get back on their feet a lot quicker, and ultimately are much happier with their surgery.
Also to note, compared to open incisions, they have significantly less scar tissue on the inside if they ever needed another procedure again in the future.
Absolutely.
How does Valley Health System ensure patient safety and quality care in general surgery?
So Valley Health System pays close attention to recruiting surgeons who are very safe and very comfortable in what they do. In addition, Valley makes sure that we are keeping up to date with all the latest technologies, all the latest surgical data in order to do safer surgery, better quality surgery, and to have better patient satisfaction.
And above all, good patient care.
For more information, please visit our website to learn more about our general surgery program here at Valley Hospital. Thank you.
Thank you.